Hello, my name is Nicole Sturman. Today I'm going to be talking about epilepsy. Epilepsy is a medical term referring to a disorder of the brain where seizures occur. There are many different types of seizures and they all cause many different kinds of symptoms. In America alone, there are over 300,000 children, adolescents, and adults with epilepsy. Epilepsy is the temporary change in the way the brain cells control awareness and body movements. 1 in 100 people will have a seizure in their life. And even though physical injuries and illnesses can cause single seizures, it is not considered epilepsy unless it is recurring. This brain shows a person that has epilepsy. The cause of epilepsy can be many things, but some examples are brain injury, head trauma, a brain tumor, birth defects, drug abuse, infection, metabolic problems, and the most common, unknown etiology. This means that it just appears one day and nobody knows where it came from. Also, everybody with epilepsy has a unique trigger that they all have. Some of the most common, however, are sleep deprivation, stress, the kind of food they eat, like sugar and carbs and stuff, and also hormonal changes. It is important to reduce triggers so seizures are kept at a minimum. There is no official treatment right now to get rid of epilepsy, but there are medicines, diets, devices, and surgeries to treat seizures. These treatments allow people to participate in normal activities to the best of their abilities. There are two different categories of seizures. One is called generalized and the other is focal. The generalized seizures start in random locations of the brain. These are the absence seizures, the tonic-clonic seizures, and the other generalized seizures. These generalized seizures are not going to be talked about today. The other section is the focal seizures. The focal seizures start from the same location in the brain each time, but is very unique for each person. These are the simple partial seizures and the complex partial seizures. The first seizure we are going to talk about is the absence seizures. That little boy had absence seizures. This type of seizures were previously called petit mal seizures. There are two kinds of absence seizures. One is simple absence and complex absence. In a simple absence seizure, a person just stares into space and flutters their eyelids for approximately 10 seconds and then goes back to doing whatever they were doing. It is not always 10 seconds, and it can range from 1 second to 20, but 10 seconds is the approximate time. Their complex absence seizures is when a person will stare into space while making movements while blinking, chewing something, or making gestures with their hands, arms, or fingers. This type of seizure usually lasts up to 20 seconds, and the person then goes back to doing whatever they were doing before. This type of seizure can occur many times throughout the day and can last from 1 to 20 seconds. This person is not aware that they are having seizures and can have up to 100 plus a day. These seizures look like a person is daydreaming or zoning out and can be very hard to recognize. If you see a person with absence seizures, do nothing. It's not very long. It only lasts 5 to 20 seconds. It is very hard to recognize, but if you do recognize it, tell them that they are having a seizure. Let them continue saying or doing whatever they are doing before they had the seizure. And if you notice a person having a seizure in class or somewhere important, and you realize that they missed important information, give them their notes or whatever they need to catch up. The next kind of seizure I'm going to talk about is the most commonly known seizure, the one that everybody thinks about. This one is the generalized tonic-clonic seizure. Yay! This one is previously called the grand mal seizure. This kind of seizure results in convulsions when the body stiffens or jerks. The person might cry out, fall unconscious, or continue jerking. Also, their bladder and bowel control might be lost. The breathing is also choppy or shallow. This type of seizure might last a minute or two, but can last much longer. The average for this type of seizure is 5 minutes, but it can last for 10 minutes. If it lasts longer than 10 minutes, somebody should call 911. After the seizure ends, the person might be confused, wary, or belligerent when the seizure ends. Some people might recover more quickly than others. If you see a person with this kind of seizure, keep calm and reassure other people that this seizure usually resolves very quickly without problems and does not require immediate attention if a person has it often. If a person has never had a seizure before, the seizure needs to be timed and 911 should be called. If there is another medical reason for the seizure and it does not end after 5 minutes, 911 should also be called. If a person hits their head during the fall, has difficulty rousing after 20 minutes, vomits, has visual difficulties, has headaches, or has uneven pupil dilation, a doctor should be seen as soon as possible. To care for a person with the tonic-clonic seizure, leave the person on the floor and get rid of anything that could harm them around them, like desks or chairs. And also put something flat and soft under the person's head so it will not bang against the person's body. The jerking body. If the person appears to be choking, turn the person gently on their side so the airway is clear and any fluid can drain out of their mouth. Also, do not try to force the mouth open or put anything on the mouth. And also do not restrain any movements. When the seizure stops, let a person rest until they regain full consciousness. The person's breathing might be shallow during the seizure and might even stop briefly. Sometimes the lip or skin can give off a bluish tinge. If a person does not start breathing again, it is necessary to give CPR. The next type of seizure I'm going to talk about is when the reality is altered. This one is called a simple partial seizure. This type of seizure is limited to one area of the brain and is a type of focal seizure. Even though consciousness is not lost, the person loses control of their body movements. Senses may be distorted and what a person sees, hears, smells, or experiences may not be real. This includes a person's emotions, which may not be appropriate for the setting. For example, if a person laughs at a funeral, this is a simple partial seizure. And if you see a person having this type of seizure, comfort and reassure this person until their senses return to normal, because they have no control over their senses. The next type of seizure is when the brain is altered and is changed differently, so the person views the world differently. This type of seizure is called a complex partial seizure. This is another type of focal seizure, and this type produces a variety of automatic behaviors in which consciousness is lost or clouded. For example, a person with this type of seizure might be seen getting up, walking around, being unresponsive to communication. He or she may mutter or do something aimlessly like tap a desk. This type of seizure might look like he or she is drugged or sleepwalking, but it is not the case. This person does not have control over their body. Some people might experience high levels of fear during this type of seizure. If you see a person with this type of seizure, and if the person appears dazed and not aware of the surroundings, gently take them by the arm, calm them down, and take them to a safe place. Also, keep them out of harm's way until full awareness returns. Also, they will be confused afterwards and will need to be told what had happened. And if somebody has seizures, they need to take some precautions to be careful with everyday activities. They should not be left alone in a dangerous environment. They should not drive. They should not swim without a friend. They also may need a service dog to help get around in cases that epilepsy is severe. And they should not be left alone around open flames or stove. And this also might cause them to not be able to work in all professions. Also, people with epilepsy often receive stigma because they're different from others. And this comes in the form of bullying and being treated differently. And also, even though stigma is bad, as somebody anonymously once said, your life does not revolve around having seizures and does not define who you are. If you want to see what seizures look like, go to YouTube and check out some links. Also, animals also have seizures, and they have all these different types of seizures, so I thought that was pretty interesting. For more information, go to epilepsyfoundation.org, call that number, go to a support group, or talk to your doctor. Since there are many types of seizures, it is very important to involve a neurologist to diagnose the person. There is no cure for epilepsy, but there are also many different kinds of medicine, special diets, the VNS device, and or surgeries that can take away or lessen seizures. For people whose seizures are controlled, life is easier. For the people where seizures are not controlled, life is a daily struggle. However, epilepsy can be managed and the individual can lead a productive life with support from loved ones, friends, and the professional community once they are educated and learn not to fear the medical condition known as epilepsy. Thank you.